and welcome to our 11:30 briefing, our daily Corona briefing. Today we are going to start with our usual updates from around central New Mexico, and our deep dive topic for today is homelessness in central New Mexico. And so we have our core leadership team here. We've got our Director of Family and Community Services, Carol Pierce, as well as our appointed Medical Services Director, Dr. Parajon. And we also have our Deputy Director for Housing and Homelessness, Lisa Huval. So you're going to be hearing from them shortly. Now, I think let's begin with a couple of updates from around central New Mexico. First, the New Mexico Economic Development Department is announcing 10 additional webinars to help business owners and community members maximize their online footprint to navigate federal and state emergency assistance. I know this is something we've been getting a lot of questions about. So check out the State Economic Development website for times for that. Also, the state is launching NM Connect. This is a new phone app that provides free 24-hour crisis and non-crisis support and access to behavioral health professionals who can text or talk via phone to individuals who need a listening ear referrals. We know that all across the country and in our state, all of these different types of hotlines are up like 50%. So it's good that people are using them, and even better that our state's stepping up with this additional online or application that you can use. The state hotline, NMCal, is still available 24/7, toll-free. That number is 1-855-NM-CRISIS. And again, that's they can talk to a number of issues, so when in doubt, call there. But that also provides a safety net services in how to connect with those. Okay, our City Councilor Cynthia Borrego is launching a really fun program that I'm excited to share with you and also participate in. It's called Lavender Libros, and it's a book reading project to demonstrate care and outreach for New Mexico's children. And this is something actually our kids have been tuning into. There's a children's author named Christopher Van Dusen who has been doing this every day for kids all across the country, but we watch it almost every day. And so now we're going to have our New Mexico version of this, which is really cool. And so today, Wednesday, City Councilor Borrego is going to present What Do You Hear by Baby Einstein. And Wednesday, I think our Lieutenant Governor is going to be reading a book. And soon I'll be up there reading a little bit from Sofia Valdez-Perez about a young woman who actually works with City Hall. It's really cool. So if you want to see that, pretty much what I would do is go to YouTube and just type in Lavender Libros, and you can tune into that for your kids. Also, want to change gears a little bit and move towards what we're working on with respect to homelessness. Before I do that, I do want to mention today, some folks might have seen some video and pictures. Our first responders organized, our fire department, police department, they organized a wonderful show of solidarity for our hospitals. So they are basically doing a kind of drive-by tribute to our healthcare workers. And so you'll see them out in front of the hospitals, UNMH, Presbyterian Loveless, and some other spots, sort of showing their support as they drive by in formation for all the folks that can see them through the windows, of course, of the hospitals. So I think a very special thing and something that's actually happening as we do this. Okay, in terms of homelessness, first, before we talk about Albuquerque area specifically, I want to mention one of our neighbors to the west. We know that people have seen the articles and the data. Unfortunately, the coronavirus is really had a strong effect on our friends and family on reservations in our tribal lands. And we know that, unfortunately, the vulnerability of our Native American population is really a sad, unfortunate reality right now of what we're dealing with all across the state of New Mexico. Now, we do have one chapter house that's very close to Albuquerque, and we view, as the city of Albuquerque, we coordinated government-to-government relationships. This is about 2 years ago by law in the city with all of our surrounding pueblos and the To'Hajili chapter of the Navajo Nation. And so we very much view them as part of the one Albuquerque region, and we've been in touch with them. And I want to mention that while everyone needs help, and especially everyone out, especially in Indian country, needs additional help on a number of fronts, our To'Hajiilee chapter has reached out to the city and said, hey, we could use some direct assistance because a lot of the assistance right now is being allocated towards parts more in the Four Corners area. So they are asking for perishable, non-perishable, or packaged food donations. And so if you're interested in helping the local To'Hajiilee chapter, I say local because folks just remember our geography, they're basically right on the other side of the volcanoes. And so they're sort of, again, adjacent to the city. So we're going to be organizing some deliveries for them. Hopefully over the weekend, we'll see how this plays out. So if you're interested in helping put food together for our friends in To'Hajiilee, the short story is contact the EOC to help coordinate at 244-8604. And we'll take it from there. And our Public Affairs Director, Alan Armijo, is also going to be working on this project. So we're going to try and get them some direct help from their neighbor, Albuquerque. Now, to talk more about what we're doing for the homeless population here in Albuquerque, I want to remind folks a couple of things. That the stay home order, right, means a pretty specific thing to almost all of us. It doesn't if you don't have a home. And so for the folks who are suffering from homelessness, this is a particularly acute problem. This is also something that I'm grateful to say our city and the leadership that you're going to hear from has been very much out in front on. Even before all of this was announced at the state level, our team was actually planning for what to do at our West Side shelter and with our providers. And so we're going to talk about what's been going on with this. But as a summary, our West Side shelter has been open 24/7, right? It's normally only open at night. Since this started, it's been open 24/7. We've also been providing testing outside there, as well as isolation pods for folks waiting results. We're grateful to say we have no positive results at this time. Now, I would say we expect positive results. Much like our fire department and our police department, mathematically, we expect that to happen, and we're ready for that to happen. Fortunately, so far, we haven't had it happen yet, but we are ready when that does occur. Now, we're also continuing to provide a lot of different options for the folks who are most vulnerable in this population, especially motel vouchers and housing vouchers and other options that are available. This also, by the way, has reminded us this urgent need for our Gateway Center. I know a lot of us are focused on Corona. People have forgotten that they voted in November to create a Gateway Center. We are actually making good progress with our city council, and actually we might even be getting some help from our county commission on how to put this system together. But the urgency remains, and this is another reminder, this would all be so much easier to deal with if we had that Gateway Center already in existence. And so it's a good reminder that we absolutely have to get that done as soon as we can. Now, with that, let me actually hand it over to one of the core team leaders, in fact, the head of our Family and Community Services Department who oversees all of this, Carol Pierce. Carol?
Thank you, Mayor. We're doing everything we can to really work with members of our community who do not have homes, which includes critical outreach to that population to make sure they have the information about COVID and how to stay safe. We also are protecting those that are serving our fellow providers out there by providing personal protective equipment and making sure they have the supplies that they need. Of most importance, I want to emphasize we are so fortunate in our community to have such a wonderful, rich system of providers serving those most vulnerable people without homes. We've been coming together for a long time, but with more intensity now on how we work together to make sure those needs are met. One recent example is a street outreach line by Albuquerque Healthcare for the Homeless that anybody can call and get help with the people that they're serving. As the mayor mentioned, our West Side Emergency Housing Center, the city's homeless shelter 20 miles outside of town, has been open 24/7 for weeks now. We are doing everything we can to keep that safe and keep people well fed and cared for, and our medical director, Dr. Parajon, will speak in more detail about that. We also are really grateful that there's many people that have connections nationally. So we're getting the guidance from the National Healthcare for the Homeless partnerships to really share that information with all our providers on weekly phone calls. Because we're the Department of Family and Community Services, we are on the front line and providing a safety net for many people. So I do want to give a little shout out. I'd like to really thank our Herman Sanchez Child Development Center. We now have 5 people that we are caring for, those children ages 3 to 5 of first responders. We are looking now about what we can do to create other opportunities and avenues for child development. I'd really like to help and do a shout out for our health and social service centers. There's one in every quadrant of our community. That team has been tirelessly providing food boxes more than normal, eviction prevention. And I really want to give a shout out to all the other departments that have come to help answer the phones and help out food boxes. And we are trying to make sure that we have information to respond to monolingual Spanish speakers and those speaking other languages as well. And I want to also, before I hand it back to the mayor, just give a personal thank you to our appointed medical director, Laura Parajon. She's been with us for a long time, working to make sure that system of support for homeless individuals is there, and her leadership is invaluable at this time. Mayor?
And actually, Doctor, you're up. So Carol introduced you.
Okay.
Step
Awesome.
up. Yeah.
Okay, great, thank you. Thanks so much for allowing me to share a little bit about what's happening here at the West Side Shelter. There's a saying that says, a rising tide lifts all boats, and that is what we see in this amazing collaboration with the city of Albuquerque. You brought all of us together, and so when we help our most vulnerable populations like the homeless, we're also helping our whole community. So I just want to share a little bit about our strategy. This is a public health strategy that's led by, we're grateful for the leadership at UNM and Carol Pierce for allowing me to take this time to be the West Side Shelter medical director. We are using a systematic public health approach that is allowing the COVID-19 homelessness response to actually be ahead of the curve than other countries. We've seen that across the country. Thank you to the city of Albuquerque and all our community partnerships that we are working together to really help the West Side Shelter operations. That's open 24/7 to provide shelter to those most in need. So that was amazing because, people who are homeless don't have a place to self-isolate. What happens when they get sick? Everyone else can have a place to shelter, but not if you're homeless. So what we've done is work together with the city of Albuquerque. All clients there are being screened for COVID. There's food available, there's showers available, and also thanks to a big collaboration, we have medical care available 7 days a week. Providers include the Medical Reserve Corps, which has been amazing. Shout out to them. Shout out to UNM, First Nations, Albuquerque for Healthcare for the Homeless, and Presbyterian. We've been all working together to address systematic care. Temperature screenings are being done. We also have developed isolation pods heading home at the West Side Shelter has helped us work together with City of Albuquerque to have safe places for people while they're awaiting their results, and now we even have hotels to place people in. 33 people have been tested since March 17th, and so far we've had no positive tests. We're also practicing social distancing at the West Side Shelter, so we're having less than 50 people or less in each housing pod and trying to maintain people to be 6 feet apart. We have no one in the top bunks, and we're using head-to-toe placement for everybody. We're also following best practices with cleaning surfaces, and we've done a lot of training alongside our heading home staff to do good personal protective equipment. So there's a lot of details on that, but we are encouraging everyone to wear face masks because, as you know, the CDC says in congregate settings, we should wear a face mask to prevent asymptomatic transmission of the virus. We're also having those who are actually screening patients wear a face mask and also goggles. So we're providing, the city of Albuquerque is providing all that personal protective equipment. And those of us who are providers there are also using a face mask and goggles, and only when we're testing are we using an N95 mask, and that's only because lab testing actually generates aerosols that can spread the virus. So that's what we're doing on personal protective equipment. We also got iPads from the city, thank you so much. We're using those to kind of prevent us from having to have a lot of exposure to people with COVID positive. So providers who are providing care can then use the iPad, and also staff to actually see what patients need. Also, thank you again. This is amazing. You guys rented special trailers that are now placed outside the isolation pad, so we have a pod so that we have a place for staff to change and use the bathroom. So thank you again to all of you, for the City of Albuquerque, for the community partners for making this possible to help us help some of our most vulnerable populations. Thank you.
Thanks so much, Doctor, and we're so fortunate to have you as well. And, you know, I remember when Carol said, we're going to appoint a medical director, and I was like, that is awesome. And so that was a move that was just very, very smart and thoughtful, and so we're in a much better place because of it. Now, we're also fortunate to have our Deputy Director of Housing and Homelessness here with us today, Lisa Huval.
Good afternoon, everyone. Paper set up. So we are doing some great work at our Westside Emergency Housing Center to keep folks in shelter safe. But we also know as a community that not everybody who experiences homelessness can utilize the shelter. That sometimes because of past trauma and mental illness, that's not an option for folks. So we also have a responsibility as a community to keep people who are living outside in public spaces safe as well. The city has historically had a strong commitment to outreach services. We fund, even in normal times, over $400,000 for outreach services, and we have convened and led a work group since early 2019 to better coordinate outreach services. During this public health crisis, we are working with a core group of outreach partners to ensure that people living outside receive accurate and clear information and education on how to stay safe and healthy. And we've also developed a system with our partners to connect people living outside with COVID-19 related medical care when they need it. As we began developing our system of care, we realized early on that another thing we needed to do was provide motels for people experiencing homelessness who are being tested for COVID-19 or who have a confirmed case. And that this motels could be and should be a really important part of providing a safe and isolated place for people to rest and recover. We now have that system in place to connect those experiencing homelessness who are being tested or have a confirmed case of COVID-19 to a motel. I want to stress, though, that this is a resource that is available for folks who have been tested or have a confirmed case. Referrals come through our medical partners. Unfortunately, we do not at this time have a motel voucher program that's just generally available to community members. And finally, we know that through all of this, we cannot forget about helping those experiencing homelessness obtain safe and affordable housing. Helping people move from the shelter and into the streets to their own apartment is probably the #1 thing that we can do to help people stay healthy, not just right now during this public health crisis, but at any time. In FY20, the city funded $9 million in supportive housing, which funds approximately 860 housing vouchers. As we move forward through this crisis and beyond, we are really committed to housing even more people. And this also includes protecting the housing of those who can't pay their rent right now by providing eviction prevention assistance, as well as funding to help folks move quickly into their own apartment and help pay the rent until they get back on their own 2 feet. Thank you.
Okay, thank you so much for those updates, and again, really appreciate our city team on this issue. I think we're very fortunate and blessed to be in a better place than a lot of other cities all around the country, and it's a credit to the 3 folks that you just heard from. I want to mention one way which you can specifically help on this issue. It's with motel vouchers and housing vouchers. If you're interested, please donate to the One Albuquerque Foundation. That's at onealbuquerque.org. They've already cut, I think, a $50,000 check that helped immediately. They did that right when this crisis broke. And so that's just the fastest way to get these vouchers out the door. Now, I also want to mention a couple of things. One is that there's a lot of discussion about community stress and individual stress during these tough times. And I want to share that that is not a myth. We usually do a myth-busting section. This one is like about the reverse. These effects are very real on us, and all in different ways. But I want to encourage folks to pay attention to some signs of this kind of notion of community stress. And a lot of it is being overly distracted. And for all of us, right, this is something where you see people sort of distancing off into space and so forth. These are early signs of, stress. Another one is just trouble relaxing. I think it's also important that as difficult as things are, try and find ways to relax, but also try and remember the little things that still are around us that we can be grateful for. And also physically, there's studies now coming out, Johns Hopkins and others, referring to folks showing increased lack of energy, changes in sleep patterns, and feelings of apathy. So it's okay to acknowledge these, to understand them, and in some ways to grieve when life changes like this so quickly, even if it's the loss of hugging loved ones, and being able to be with people that we know and love, whether it's friends or family. I think the biggest thing is just pay attention to yourself and your friends and family in this situation, and then reach out if you need help. These sort of old-fashioned ideas about hotlines are actually very successful. So when in doubt, actually give them a call. They actually have shown results from time and time again. So with that, let's talk about takeout, something small to celebrate. Yesterday was the grill. So excellent food as always from the grill. All right, with that, I think we are available for your questions.
Any in person? We have a call, Mayor, from Hannah Colton from KUNM. The CDC has recommended guidelines around encampments, homeless encampments, and the concern that it can cause people to disperse and come into contact with more people if they are dispersed. Can you tell us what the city is doing around this issue?
Yeah, sure. Questions about encampments and some of the CDC guidance. I think I'll let whoever you want to do, Lisa or Carol? Probably Lisa. So Lisa can come up in a minute and speak to that. I do want to share a couple of things about this. That was really intended for large existing encampments that a lot of major cities have. We do not have that. So that's one thing that's just kind of an apples and oranges comparison there. The other thing is, unlike a lot of other cities also, is we have somewhere better for folks to go to get medical care. So that guidance was really aimed at, again, these huge encampments like on the West Coast that were already in existence for months, if not years, and also cities where they don't have the kind of services that we just outlined. So in addition to that, Lisa?
Yeah, I think we can add to that. There is this difficult need to balance the health and safety of encampment residents with the health and safety of other folks who live in our community as well, and that's always a tricky one with encampments. Our focus on encampments has really been around providing really good outreach to encampments. We have staff within the city that does that, as well as our core, some of our core service provider partners, really collaborating with them to make sure that we're getting really good patient education and information out to encampment residents, that there's a clear process to connect people to medical care if on those outreaches we're seeing folks with COVID-related symptoms, and that we feel like that is the best way for us to protect those folks who are living outside in public spaces. And of course, our Westside Emergency Housing Center does have capacity. And if there are folks sleeping outside who want to come into the shelter, that is always an option for people where they can, as the mayor said, also receive follow-up medical care.
Other questions?
Yes, we have a follow-up from Hannah. Community members have erected hand washing stations in the International District weeks ago. How many public hand washing stations has CABQ set up, and have you set up any? Where are they located? Are there plans to build more, and what's the timeline for that?
The question is about hand washing stations and additional porta-potties for our homeless population. What we're trying to do, again, is the healthiest, safest place for these individuals to be is in our system so that we can get them housing and a hotel and an apartment and so forth. So that's our first goal. However, we know that's not going to work for everyone. So we're actually following the community's lead and we're testing this out. So what I would basically say is that stay tuned. I think for next week, we'll probably have some more details on this. Right now, we've put a few hand washing stations out and we're tracking to see how they're used and if it's successful or not. And we'll have a more detailed follow-up next week.
Okay, we have one from Jessica Dyer at the Albuquerque Journal. What is the average average nightly census at the shelter over the last month?
The question is, what is the average nightly census or count at the shelter? And so we'll let our medical director field that one.
Sorry, I can't get my mask off. Sorry, my mask is stuck. Okay, I'm just gonna leave it on, sorry. So the average census, it's actually decreasing because of efforts from the city to decrease areas so that we have other locations for people experiencing homelessness. So it's about 350 now. And also, I just wanted to add something to what Lisa was saying, is that our partners, First Nations and Albuquerque Healthcare for the Homeless, are actually have a phone number for people experiencing homelessness who are living on the streets. It's 414-0653, because there is a group, a subset of people who actually are not, sorry, I got it, okay. There's a subset of people who are not going to be able to, live in a hotel, or they want to live outside, so there's a number to call where our Healthcare for the Homeless and First Nations partners are. And also, can I just say, also important message from our ERs is that if you are really sick, if you're feeling short of breath, if you're feeling tightness in your chest, please go to the ER, because respiratory symptoms with COVID can be really serious, and don't wait, right? Because sometimes it might be too late. So we just wanted to add that as a health message.
Thanks. Okay, and just with respect to the specific numbers too, what we're going to do, Lisa Huval will follow up with you, journal reporter, and give you those numbers. So stay tuned for that.
Awesome. We had another question from Kai Porter asking about those who are unable to be at the shelter and get tested. Are there mechanisms by which they will get tested otherwise? Are we doing mobile testing?
The question is about if we're able to do mobile testing if people don't get to the shelter. How are we sort of handling that? Very good question as well. We're bringing our doctor back up for that one.
Thanks so much. Yeah, that's once again, that's with Healthcare for the Homeless and First Nations. They're doing the testing for that. So that's great. They're doing mobile testing, and they have, like I said, this number that people can call. So it's really great.
Okay, and one more from the Albuquerque Journal. How many motel vouchers for the homeless individuals has the city issued during this epidemic?
The question is about how many vouchers we've issued during this epidemic, homeless or apartment. So that might be one. We'll have to follow up with the exact numbers, or do you know it off?
Yep, I got it.
Okay, all right, Lisa Huval.
So this number is current as of yesterday. We had provided motel vouchers to 15 people as of yesterday. Those days ranged from a couple days to a little longer, but it was a total of about 50 bed nights altogether that we had provided.
Okay.
I have another one.
Okay.
From Mayra Aguilar from Univision. Do people need a social security number or legal documentation to apply for housing or any housing programs?
Question is about what kind of documentation is required for the housing programs. And Lisa will take that one too.
I would say the answer is it depends on the funding source. So it's hard to give like a clear-cut answer to that. Just depend on which program the housing voucher is funded through. Folks are certainly welcome to, to call and find out more about a specific housing program.
So just for our programs, you don't need any of that documentation for the ones that the city does exclusively. Okay, all right, that's good for now. We will see you again tomorrow. Thank you so much. All right.
Oh, it's hard with glasses. They get all